Okay, so we're going to be talking about spinal decompression, self-decompression strategies. So this comes from the University of Waterloo and the work of Stuart McGill. He talks about using this not only in vitro, in cadavers, but then also in vivo, where they actually have looked at the reduction of the nucleus back into the disc. So in instances where you're otherwise feeling back stiffness and or discogenic, that is, say, radiating pain in the buttock and or leg, then this is going to be 4 strategies to help you with this. So we're going to utilize your diaphragm, which is your big umbrella muscle that underlies your rib cage and attaches to your lumbar spine. And as we go through full inspiration and expiration with the diaphragm, we're going to be decompressing the spine. As it pulls on the vertebra, it's going to create a negative pressure within the disc, allowing for fluid to flow back into it. And we're going to be doing this in very strategic positions. So the posterior annulus, that is the back of your disc, is most sensitive to compression, just given our activities of daily living. So option number 1 is this. So you're in a prone prop position. If this is intolerable, then you would be here. And you're going to breathe 4 seconds in, 8 seconds out. 4 seconds in, 8 seconds out. With my emphasis being not so much belly out and back into the table, though you'll feel that pressure, it's more out and lateral. So that's what's occurring. Within the first 5 minutes of doing this, in vivo, they see no difference or reduction within the disc bulge. At 10 minutes, however, those individuals that have a preservation of at least 70% disc height, that is, the majority of people under age 55, would respond positively to this. This has also been somewhat encountered to what is your prone press-up, though this is certainly endorsed by most McKenzie-based therapists. If done repeatedly at a high frequency or dosage, this can otherwise sensitize the extensor mechanisms of the spine and thus lead to aggravation if done for prolonged periods, such as several months, and or if done vigorously within a short time period. So this is option 1. This is your position of respite or relief for your symptoms, either forehead down and or in the prone prop position, gently breathing for 10 minutes. 10 minutes is a lot to ask, but your spine's vital to everything you do. I encourage you to use it appropriately. Next is if you have an overhead object, such as it doesn't have to be a bar or a pull-up bar. It could even be like a door frame. And I like to actually have people utilize a stool. I'm going to gently sink down into it. Big breath in. Big breath out, making my pelvis really heavy, and I'm sagging into it. Keeping that sag, I'm going to inhale again. Notice the expansion of the ribs. Exhale, sink it back, sink the tail back down. So in my mind's eye, I'm imagining I'm expanding the rib cage like this. Again, getting slight extension, distraction, causing negative pressure, fluid filling within the disc. If I don't have an overhead hang or a door frame or something of the like, then I can do, I've been sitting for a long time. I stand up, I slowly come up to stand. I get what I imagine is my Spider-Man, palms to ceiling. Inhale, making myself as tall as I can. Keep my hands at that position. As I exhale, again, the active decompression of the spine as everything sags down, but I stay tall. I would remain there for up to 2 minutes. If you get numbness and tingling into your hands, join the club. You're only human there, as blood flow doesn't really go upwards against the heart or against gravity, as the heart tries to pump that way. But as soon as you come down, let it dissipate. It should otherwise reduce. Final one is if you don't have that option, or you are self-conscious and you don't want to be doing that in public. They also talk about the strategic decompression against your the back of your park bench. This could be a countertop, it could be the back of a chair, something sturdy so you're safe. Same sequence of events. I'm gently sagged into extension. Emphasize the exhale, fill it up. Exhale, and I try and push myself down as I exhale. Elongating the spine. Again, the line of pull of the diaphragm, trying to get a little bit of segmental distraction. And because of the fluid and the viscoelastic properties of the disc, you need the temporal component. Be patient with it. If you don't get immediate relief within 30 seconds, don't fret. Continue to expose yourself to this. Again, the 2-minute time frame is the sweet spot for some of these last two, and 10 minutes for the first one. Frequency is going to be your friend. If you do it once in a day, you're not going to notice a difference. It's going to be the segmental or the periodic decompression of the spine that's going to be helpful in this acute, subacute stage where you're having all the stiffness in your spine.